Hi breathers! In this video, you'll learn a breathing technique to relieve asthma. Breathing is living, and if you've ever had difficulty breathing, then you know how scary it can be not being able to catch your breath. Asthma narrows your airways, making it more difficult for you to breathe. Some asthmatics experience coughing, wheezing, shortness of breath, and a tightness in their chest. This happens when the airways become inflamed and more sensitive, reacting to irritants that you inhale. Typically, these symptoms are treated with inhalers that deliver medications like bronchodilators, corticosteroids, and anti-inflammatory drugs. The cool thing about these medications is that they mimic the hormones that your body naturally produces. The bronchodilators that help keep your airways open act in the same way that your own adrenaline or epinephrine does, and the corticosteroids are a synthetic version of your cortisol hormone, helping reduce the inflammation in your lungs. The breathing technique in this video aims to produce those very hormones naturally with your own breath. It's a slow peak inhale, followed by a retention, and ending with a ventilation. The slow peak inhale aims for your total lung capacity to increase your lung volume as much as you can. This not only helps open your airways with an increase of volume, but it also triggers a sympathetic response, helping to produce that adrenaline or epinephrine to open your airways even more. The retention helps maintain that increase in lung volume and that sympathetic response. But the key with the retention, the inhale breath hold, is that you have to hold it a little bit past your edge of comfort, because a comfortable breath hold actually reduces your heart rate and can trigger a parasympathetic or relaxation response. But we're trying to maintain that sympathetic response, so you want to hold your breath just a little bit past that edge of comfort. Then you'll exhale with a ventilation, which is like a hissing whistle sound. And this is to slow down your exhalation, trying to continue to maintain that increase in lung volume as long as possible, but also to increase your CO2 tolerance and continue to help with the reduction in inflammation. So wherever you are, blow all your breath out. Flare your nostrils, breathe in slowly but fully, as much air as you can fit. And when you think you're full, get an extra sniff through the nose, extra sip through the lips, and then hold. Try to relax your shoulders, push the shoulders back as you're in the breath hold. And remember, you're only holding here a little bit past that edge of comfort. So right when you start to get uncomfortable, take your tongue, place it behind your two front teeth, and make a ventilation or a hissing whistle sound. You're trying to make that ventilation nice and long and slow. And you can notice that a refinement, if you're used to doing this breathing technique or as you practice this breathing technique, is at the beginning, I had a lot of pressure and a lot of speed, which made it sound more like a hiss. But towards the end of the technique, you could start to hear that whistle. And that's kind of what you're going for, because that's going to allow you to reduce the pressure and the speed to increase the duration to get more of an effect from the breathing technique. So let's do it one more time. Wherever you are, blow all your breath out. Inhale through the nose, fully but slowly. Extra sniff through the nose, extra sip through the lips. As you hold the breath, roll the shoulders back. Place the tongue behind the two front teeth, ventilate the breath out. Really good. The time it takes for you to complete one full round of this breathing technique is going to be unique to you, your breathing mechanic strengths, and your CO2 tolerance. So while my inhale might be a little longer, a little shorter than yours, the goal with the peak inhale is to go nice and slow, but really make sure you're full, aiming for that total lung capacity. Your retention might be a little longer or a little shorter than mine, depending on when you really start to feel a little bit uncomfortable. And your ventilation, again, might be shorter or longer than mine, depending on your ability to stretch that ventilation, that whistle sound, as long as you can with control. The goal of this breathing technique is not to feel breathless. So if you go through one full round, that peak inhale, retention, and ventilation, and you feel like you have to gasp for breath, then you're making it a little too long. So you want it to be sustainable so you can maintain a few rounds for about 2 to 5 minutes. You'll use this breathing technique anytime you go into a trigger for an asthma attack or irritation. For instance, if you know that every time you exercise or every time you're exposed to pollen that your asthma gets triggered, then you would use this breathing technique before you go and exercise or before you go outside. You can also use this breathing technique as a preventative practice for asthma, practicing it about 2 to 3 times each day for about 2 to 5 minutes each time. Maybe once in the morning, once in the midday, and once in the afternoon. Allowing yourself to do this consistently is going to increase the strength of your breathing mechanics, increase your lung volume, and your CO2 tolerance. So I want to put a disclaimer here that I'm not encouraging anyone to stop using their inhaler. Medication is important, especially when you really need it. But I do want to encourage you to practice this breathing technique more as a preventative practice and an alternative method. I hope this video helps you reduce and relieve your asthma, and let me know in the comments below how well it worked for you. If you want to learn more breathing techniques for all types of applications, join me in my online breath technique training, where I teach you over 60 different breathing techniques. And don't worry if you're not ready to up-level your breath education that much just yet. I also have a free breath awareness program on breathguidance.com. If you liked this video, please hit the like button, subscribe to my channel, and share it with your friends. I'm Danny May, and I sincerely hope to see you more around breath guidance soon. Bye.